Welcome back, everyone. So helping people begin their journey towards a smoke-free life. That is the goal of the Great American Smokeout and also Lung Cancer Awareness Month. According to the American Cancer Society, there will be more than 200,000 new cases this year and about 130,000 deaths. Joining me now is Dr. Kasey Treger, a pulmonologist at Ascension St. Vincent. Thank you for joining us today.
Thank you for having me.
You know, I always start with this. My father died of lung cancer back in 2009, so I know what this journey is to stop smoking. I mean, by the time he really was like, I'm ready, I'm going to kick the habit, it was already too late. It is a really tough journey because smoking is so addictive.
It is, and I'm so sorry that happened. It can be one of the most difficult habits to break, and it can still be the most important thing that anyone does to help their future health.
Yeah, Dr. Treger. Oh, go ahead. I'm sorry. You go ahead.
Go ahead.
I was just going to ask. I think what's amazing and hopefully will be the most motivating for people is that once you stop smoking, so many things can change in your life and in your body very quickly.
Yeah, absolutely. I mean, just within 12 hours or so, your heart rate decreases, your blood pressure decreases, and those effects continue on. Lung cancer risk decreases after a period of time. After 5 years, there's a significantly decreased chance of having lung cancer compared to if you were continuing to smoke.
So this is the Great American Smokeout. It is a wonderful time. If you've been thinking about it, meditating on it, why not try and get a community around you to help you stop smoking?
Absolutely. The Great American Smokeout was created about 40 years ago by the American Cancer Society as a day to challenge people who smoke to give it up for 24 hours or come up with a plan to quit. They found that if people quit for just one day, there's a higher likelihood of them being able to successfully quit in the future.
That's amazing. 24 hours, that's all we're asking, so why not do it now and know that other people will be doing it with you. Let's just talk about lung cancer, because the problem here is so many people are diagnosed so late because the symptoms are hard to detect. What are those possible symptoms to look out for?
Well, the symptoms can be varied and can include, like the list says, cough or chest pain. But the key is really to get lung cancer diagnosed before those symptoms start, as many of these symptoms could indicate that the cancer has already spread. And we really want to try to find cancer before it's reached that point, which is why lung cancer screening is so important for the successful treatment and cure of lung cancer.
And Dr. Treger, talk about that screening, because I know people who have lung cancer who never smoked. It's just sometimes it feels very random, the people who can get this disease.
Yeah, unfortunately, about 80% of those diagnosed with lung cancer are in fact smokers or have a former history of significant smoking. And those are really the high risk patients and people that we try to identify to get into a screening. And we screen with an annual low-dose CAT scan to look for early potential cancers, what we call pulmonary nodules, which are small spots that could potentially be very early cancers.
All right. Hey, thanks so much for talking to us. 2 things to do today, folks. If you're watching this and you're a smoker, give yourself 24 hours. Just put it down and say no, and then get that screening if you are a smoker. Thank you for talking with us today.
Thanks for having me.